The contents of this video is for informational and educational purposes only. The information contained in this video is based on the author's experience and training as a paramedic and in no way qualifies as medical advice. Always consult your physician about any medical condition or treatment of any medical condition. The author of this video is not responsible for what you do with the information. Hey everybody, this is FireDog529. This is a video that I've been meaning to do ever since I put out my first antibiotic video. Those of you that have kids, this is probably going to be pretty useful to you. And in the event of a STHF scenario, you know, we're still going to have kids running around. So anybody who's stockpiling the antibiotics, you really this is some information that you really need to know. I think most everybody is familiar with the pet medication antibiotics that most preppers on YouTube are stocking now. They're relatively inexpensive and easy to get. You don't have to have a prescription or anything like that. And it's a regular adult dose. Let's see if it'll pick it up. Amoxicillin, 500 milligrams, which is a normal adult pill. And as I've told y'all the last time, if you take out one of the pills and you look at it, it's got the numbers imprinted on it, the numbers and letters. If you were to type that in to Google or whatever search engine you use, it will come up as amoxicillin. It doesn't say fish mox, it doesn't say pet medication, it says amoxicillin. So this is the exact same stuff that you get at a pharmacy for yourself. But my hands are pretty big, and you can see how big this pill is. Kids don't typically swallow pills. More specifically, infants do not swallow pills at all. Amoxicillin is a great medication for kids. It's not necessarily the first pick of pediatricians anymore, but it used to be, and it's just a great all-around antibiotic. But it doesn't do you any good if you don't know how to give it to them or if they can't take it. Like I said before, this is an adult dosage of amoxicillin. It's 500 milligrams. To determine your pediatric dosage, I use drugs.com and the FDA and CDC and all those websites have all kinds of good information about this. But just for our purposes, I'll use the otis media, which is an ear infection. Kids get ear infections all the time. I don't know how well you're going to be able to read this on my camera, but I'll read it to you. 4 weeks to 3 months, 20 to 30 milligrams per kilogram per day in divided doses every 12 hours. Well, what in the world does that mean? First off, you have to know how much your kid weighs. And I'm going to stop the camera for just a minute and set up my little whiteboard so I can give you a little bit better idea of how all this works. Okay, I actually read you the wrong line item there. I read the 4 weeks to 3 month dosage. To make the math a little bit easier, I'm going to do the 4 months to 12 years dosage, but the same applies for any medication that has a weight-based dosage. And usually all of your pediatric dosages are all going to be weight-based. So 4 months to 12 years, 20 to 50 milligrams per kilogram per day divided into 12-hour doses. The first thing you have to do is figure out how much your kid weighs. Let's say that my 5-year-old got an inner ear infection. She weighs 55 pounds, which that's not exactly how much she weighs, but we'll just say she weighs 55 pounds. Okay. Pounds are not kilograms. you have to know the difference and be able to figure out how to convert it. The conversion is actually very simple. I didn't bring my calculator, so I will use the trusty iPhone just so I can show you. And when you do this long enough, you can figure out most of it in your head, just based on you know, repetition. But the formula for it, you have a kid that weighs 55 pounds. 55 divided by 2.2. 25 kilograms. That's how much a 55-pound child weighs. 25 kilograms. 25 kilograms. So, that's the first part of the equation. Now you're giving 20 to 50 milligrams per kilogram. So if one of these is 500 milligrams, and you're supposed to give 20 to 50 milligrams per kilogram, which means, say you're giving the top dosage on the top spectrum, 50 milligrams. That'd be 25 milligrams times, 25 kilograms times 50 milligrams, 1,250 milligrams per day, divided into 12-hour doses. Well, there's 24 hours in a day. 24 divided by 12 is 2. So you would divide that by 2, and you're going to want to give 625 milligram dose twice a day. Now, that being said, that seems like a little much. I mean, the normal adult dosage is 1,500 milligrams a day, and this is 1,250 milligrams. So, but you have your dosage now. So your dosage is going to be 625 milligrams given every 12 hours. Well, how do you do that if it's a pill? Your kid can't swallow a pill, so what do? Well, the pill is a capsule. It comes apart. And the exterior of the pill has no medications in it. It has no medical powers, or however you want to say it. It's just the stuff inside. So you can break that pill apart into a little bowl. See if I can do this without making a mess. I should probably stop the camera, but oh well, y'all get to see the outtakes. Okay. Alright, capsule's empty. All of the amoxicillin is in the bowl. Now, that was 500 milligrams, and we're shooting for 625, right? Okay, so one pill isn't going to cut it. We take our other one. There. Now, empty also. So now we have 1,000 milligrams of amoxicillin in here, which is more than what we're supposed to give a kid. That's okay. We have a plan for that too. Now, what you mix this with, always have a pre-measured way to mix it. If you do a syringe, 10 cc's of distilled water, because you're going to be sure that the distilled water has no bacteria in it or anything else, no other minerals that may react with the amoxicillin. Give me just 1 second to draw up 10 cc's of water. Okay, 10 cc's of distilled water. Alright? You may actually have to use a little bit more, but then you're going to mix it. And you're going to try to keep it as sterile as you possibly can. And it may work better to use 20 cc's. Okay, there's my second 10 cc's of distilled water. Okay, we're still mixing. I'm using the tip of the syringe because the syringe was in sterile packaging. And remember, this is only for an SHTF scenario in the event that we don't have doctors, we don't have hospitals, we don't have pharmacists, we don't have EMS, and you are all on your own. Because if this were to happen today, you take your kid to the doctor and you get them to do this. Okay. Once you have that pretty well mixed up and all of the medication is diluted, you can draw it up with your syringe. Okay, so now I have 10 cc's of amoxicillin mixed into distilled water. Well, how much amoxicillin is that? We put 20 cc's of water and 1,000 milligrams of amoxicillin in here. So 10 cc's is going to be 500 milligrams. You follow me? You've got 20 cc's of 20 cc's or 20 milliliters. A cc is the same thing as a milliliter. You've got 20 cc's of water and 1,000 milligrams of amoxicillin. So if you draw up half, if you only draw up 10, you're going to get half of that, 500 milligrams. Right? So 500 milligrams, but our dose is 625. So we have to figure out how much is in each individual milliliter. If you've got 500 milligrams in 10 milliliters, then that means you're going to have what, 50 milliliters, 50 milligrams per milliliter. I know med math can be very confusing. So each cc is 50 milligrams. So if you're supposed to give 625, okay, you give them the first dose, bam, they've got 500 milligrams. You've got to give 125 milligrams more. So, how much is that? Okay, the camera cut off on me. Okay, so you gave your first 500 milliliter dose, or 500 milligram dose of amoxicillin. You still have 125 milligrams to give. So how much is 125 milligrams? We've determined each cc, each milliliter is 50 milligrams of amoxicillin. So 1 cc is 50, 2 cc, that would be 100, 3 cc would be 150. We only have to give 125, so you go halfway between 2 and 3, and that gives you your 625 milligram dose of amoxicillin for your 55-pound kid with an ear infection. Now, I know this is hard to follow, but the math is the same for any dosage of weight-based medication. And for amoxicillin, for the most part, the dosage is pretty much the same for just about anything. I think pneumonia, the dosage actually gets a little bit higher. But for the most part, the amoxicillin dosage stays at 20 to 50 milligrams per kilogram per day. So, if you're doing it at the top of the spectrum at 50 milligrams per kilogram, and you have a 55-pound child which weighs 25 kilograms, that dose of 50 milligrams per kilogram is going to be 1,250. You divide that dose into 2 doses, you get 2 625 milligram doses. So, I hope I didn't confuse everybody too much, but this is information that I think needed to be shared. I feel like I'm taking a little bit of a risk by doing this, but I'm not assuming any liability for what you do with this information. It's for informational purposes only, but it is a way to be able to administer medications to kiddos in the event that we don't have hospitals and we don't have doctors, and none of that's readily available anymore. So I'm sure there's probably going to be a ton of questions about this. Please, if you have them, ask. I would much rather you ask me now than get into a situation where you have to know this information and do something wrong and end up hurting your kid. Because, I mean, you're dealing with life. It's not there's not a whole lot of room for error. So again, like I said, I was hesitant about putting this video up anyway, just for that reason. But I think it's something that that needs to be said, and I think it's something that everybody needs to know. You need to learn how to do your med math, and you need to learn how to make these medications, to mix them up to where your kid can take them. So please ask questions if you have them. I'm usually pretty good about returning PMs very quickly. It's the comments that that I'm slacking on right now. But anyway, I hope this helps somebody. And like I said, please, 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 I can't stress it enough, ask me the questions. I promise I won't make you feel stupid when I answer them, because this is complicated stuff. The only reason I can do it for the most part in my head is because I've been doing it for so long. So and it did not come overnight to me. It's something I had to practice, and I do it for a living every single day, and I still double check everything I do. So ask me questions, leave me some comments if you want to, but I really do hope this helps somebody. So I will talk to y'all later, and y'all have a good day.